Yes.
So we are discussing urinary system pathologies. Yesterday we discussed kidney, important kidney pathologies. Today we'll discuss other than kidney we have ureter, we have urinary bladder, and you have urethra. So these are the non-functional structures of urinary system. Kidney is the functional organ of urinary system, urethra, urinary bladder, and ureter. These three are non-functional structural organs of urinary system. Okay. So let's discuss ureter, urinary bladder, and urethra. They have more numerous diseases. It's difficult to cover all those, but I will mention here four important diseases where we are we will see in our clinics mostly. One is urinary bladder calculi. Okay, and second one is the the calculi may be in urinary bladder or in ureter. Okay, or urethral injury, and third one is urethral stricture, and fourth one is adrenal adenoma. Okay, all these three we'll discuss. Okay, so these are the four common diseases we'll see in regular basis. So let's discuss about that. So you can see this is the urinary bladder. We have kidney. This is right kidney. This is left kidney. Right kidney slightly below than right left kidney. Okay, then you is ureter, and we have urinary bladder, and we have urethra. So you can see this is the one type of kidney stone. Okay, it may be developed in kidney, then later it will enter into urinary bladder, or sometimes it will develop itself in the urinary bladder. These may possibilities are also there. Okay, so these are the important things we have to remember. There is a very severe pain while sometimes while urinating, or after urinating, or before urinating. Okay, three symptoms may be occurs to the patient. You can see the scan X-ray. Here you have the stone which you can easily able to see in this X-ray. This is a KUB X-ray. Or sometimes it's the only bladder are seeing, but this is KUB X-ray. Next common type of disease you can able to see. What is the investigation of choice? We I forget. What is the investigation of choice in a renal calculi? Sorry, urinary bladder or ureter calculi. What is the investigation of? The investigation of choice is NCCT KUB or abdomen, whole abdomen. Okay, means you can able to see all the uh, structures: kidney, ureter, okay, urinary bladder. Okay, all these structures we can able to see in the NCCT. Next, we have another type of disease, that is injury. Okay, urethral injury. Urethral injury, here you can able to see that yes, urethral injury. Urethral injury sometimes a deep injury. You can see this is the rupture of membranous part of urethra. This is urinary bladder. This is urethra. Okay. This is the ligaments which hold, and this is the uh, anus. Okay. This is the testis. Okay. This is ureter. Sorry, urethra. So urethra is damaged, ruptured happened, little bit ruptured happened. Why happened? There is number of common causes due to the sometimes it is due to the injury, trauma, or nowadays common problem of urethral injuries are biking right continuously by taking large of heavy weights on thigh region. Okay, it leads to damage of urethral urethral pipe. Okay, here it causes pelvic fracture also, pelvic injury, hair injury, fall from the bike. Okay, all those the reasons. Okay. Mm, Next we have superficial, and this is you can see this is the very deep injury. Deep injury. Okay, this is rupture. This is deep injury, which leads to uh, connect connection is breakdown. Connection is breakdown. Okay, so these are the very problematic things. Then sometimes it is needed surgical intervention. Sometimes it will can be treated. So what is the investigation of choice in that? The investigation of choice is RUG. Already discussed RUG, retrograde urethrophy. Okay. Next problem, most common problem, that is you can see this is the most common problem. That is urethral stricture. You can see it is the normal urethra here. The flow is normal here. Here you can see this is the blockage. And this urethral blockage is there. Urethral stricture is a scar tissue. A tissue, extra amount of tissue is deposited there in the pathway of urethra. Okay. Exist of the body carrying urine means the urethra is carrying urine from away from the urinary bladder, outside environment. So what happened if the tissue become connected, the urethral stricture, what happened? Difficulty in urination. Patient need pressure to excrete the urine. Okay, then what will happen then? Large amount of urine cannot be excreted. Okay, and patient have numerous infection. Okay, patient have difficulty in urination. Small amount of urine he will pass. Rest of the amount of urine is stored in the urinary bladder. So what they do in the doctors will sometimes they will do surgery. Whatever stricture is there, it reveal the tissue from there, and they do the surgery of that area. I can see in the in this image also the urethral stricture. This is a structure like knot, like knot, just like knot. Blockage is happen. Like you have this type of problem. This is will happen. Knot. Okay. So this is urethral stricture. Okay. This is the most common disease. Next, what is the investigation of choice? Already I told you. RUG, urethrophy. So it will give you the information of complete urethra. Okay, structural problem. Here there is a blockage. Blockage may be fully developed, so it cannot be passed. So we have to need to cut this down. Okay. Next we have another problem we have that is very common. that is adrenal adenoma. Adrenal gland is above the kidneys. We know that it is like cap of kidney. Like for the king, they have crown, okay, which showcase they are the kings, king of the city, king of the town, king of the kingdom, etc. Here, like kidney had the crown. The crown is nothing but the adrenal gland. So kidney is the king of our body, but main king is our brain. But if you collect all the organs in that, kidney had numerous functions. Okay, it is not less than a king. Okay, kidney had the crown. The crown name is adrenal gland. So in the adrenal gland, we have two areas: outer cortex, inner medulla. You can see that this image here, outer cortex, inner medulla. So it will develop numerous hormones, epinephrine, non-epinephrine, testosterone, etc., etc. Adrenal gland. Okay, outer cortex will produce some hormones. Medulla will produce some harm. So if any problems occur in the adrenal gland, that is called adrenal adenoma tumor. You can see this is the outer portion, not inside the parenchyma, within the cell of adrenal. It is outside. So it may be benign or cancerous, sometimes benign. Okay. So hopeful. This is the uh, most common disease. Okay, nowadays. So what is the investigation of choice? Investigation of choice for adrenal adenoma is nothing but MRI of KUB because it is soft tissue. So for all types of soft tissue, you need to go to the MRI for correct diagnosis. Okay. So these are the important diseases we have to know about that, the particular pathologies and the radiology also. What are the important scans to be advised for the particular diseases? Okay, so these are the things we have to remember. So next we will discuss after the urinary system pathologies and radiology imaging. After that we have mhm, next we have neuroradiology. So in from Monday onwards we'll discuss neuroradiology. In that, how what type of scans are there for nervous system, and for which disease which scan to be done, and means pathological conditions and scans. Okay, so different types of
Yes.
head, neuro, head, neck, everything we will discuss in coming class. Okay, I hope you understood about this radiology, this class. Okay, so thank you very much.